Hello, my name is Jackson Anderson. I am a third-year medical student at the University of Miami Miller School of Medicine. Today I'm working with Taha Rasul and Daniel Bergholz, who are also third-year medical students at University of Miami Miller School of Medicine, as well as Dr. Armen Henderson at University of Miami. We're working in conjunction with the Miami Street Medicine Clinic, and today I'll be presenting an abstract titled Understanding Chief Complaints of Unsheltered Individuals in the Miami Medical District. So, a little background on the study. Rates of homelessness in the United States have been going up steadily since 2018. The COVID pandemic has not helped with these rates either. Currently, there are about 500,000 to 600,000 unsheltered individuals in the United States, and many of these individuals are privy to chronic health conditions, which can be worsened with the environment they live in, their access to food resources, so on and so forth, which predisposes them to nutritional deficiencies, worsening chronic medical conditions, wounds, etc., etc. It makes this a very high-risk, vulnerable population. So we felt it was important to understand the needs of this population through understanding chief complaints so that we can further address and tailor care to the population in the future. So the way we did this was that patients were encountered weekly at Miami Street Medicine mobile clinics from April 2021 to January 2022. And we were able to analyze the chief complaints of 90 individuals. There were a total of 104 chief complaints that we analyzed because several individuals had multiple chief complaints. And then these chief complaints were grouped into relevant categories. So the categories included blood pressure management, health management, wound care, and then a series of organ system-based categories, including cardiovascular, dermatologic, musculoskeletal, gastroenterologic, ear, nose, and throat, psychiatric complaints, and so on and so forth, to make a total of 20 categories. So, kind of the results and the conclusions that we drew from this were, first off, a large percent of this population presented for blood pressure management. And we do know that hypertension is a major issue within the United States, but especially within this population that is exposed to high stressors within their living environment, as well as having limited access to food, limited access to areas to get bed rest, and worsening chronic medical conditions can contribute to worsening hypertension. So with this being a major presenting chief complaint in this population, we felt it was important to, mention that in the future, teams that are working with this patient population should be prepared to provide antihypertensives and follow-up care, potentially, providing more blood pressure monitors for homeless shelters so the patients can monitor their blood pressures, and so on, because hypertensive management was a huge chief complaint in this population. And then second to that, we saw that about 25% or a fourth of the patients roughly presented for either a musculoskeletal complaint or a wound care complaint. And while these are very different complaints, we grouped them together because about a fourth of the patients came for one or the other of those complaints. As far as the MSK complaints, it was mostly related to chronic joint pain. We felt this could easily be addressed by routine follow-up care and potentially working with clinics that support this population to provide some kinds of physical therapy. And then additionally, as far as wound care goes, this population, we have talked about how there's a lot of chronic medical conditions that can be a problem with this population, and as well as with their living conditions. Traumas, worsening ulcers are not uncommon, and so with regular follow-up wound care management and educating patients and providing them materials to properly clean and dress wounds could make a huge difference in wound care. The remainder of the chief complaints mostly related to chronic health management, medication follow-ups, and so we felt that with proper long-term management and regular follow-up, that most of these chief complaints could be addressed, and that regular follow-up could make a huge difference within this patient population.